This is a presentation on the Patient Protection and Affordable Care Act and some of the summaries and law around this and the reforms that it ended up making. As an overview, this was signed into law on March 23rd, 2010 by President Barack Obama, and it was appropriately titled the Patient Protection and Affordable Care Act. It's the largest piece of legislation that's been regarding healthcare insurance that's been passed since 1965 when Medicare and Medicaid were passed. It's been called Obamacare by many, but that really is a slang term, really. Most refer to it in a shortened form as the Affordable Care Act, or the ACA. It had some immediate benefits that it applied within the first 6 months to 12 months from when it was passed, and then some long-term reforms that began in the year 2014. And the goal of the legislation was to increase healthcare access to more citizens and residents of the United States and to help out those who are uninsured. Here's some of the immediate benefits and the different impacts that it had on people. First one, impact on individuals. The Affordable Care Act expanded healthcare coverage to children who up until the age of 26. So they were required to be covered by their parents' insurance up until the age of 26 now, unless they personally were covered under their own employer plan. So that had the immediate effect of helping out those who were uninsured, completely uninsured, up again to the age of 26. And it immediately required coverage of some preventative and emergency services, some things like immunizations, things like child care, preventative care, women's health, such as mammography and breast cancer screening. It did that in an immediate kind of way. The next thing it did, it had an impact on employers. And it created immediately a tax credit program for small employers to help them fund health coverage. Small employers at this point was defined as those who had less than 25 employees and their average annual income of each employee was less than $50,000. But what it did was, this tax credit program was, the federal government required that employers pay at least half of the premiums, but they would cover the rest, the other half, up to the other half. So that was a nice program. Now, it also has some impact on payers, insurance payers. For one thing, it prohibited healthcare insurers from imposing annual and or lifetime limits on the value of their benefits immediately. Secondarily, they couldn't rescind payment for care based upon unintentional information. And this was a change because even if a beneficiary had accidentally put the wrong information on their enrollment form, healthcare insurers could go back and say, well, you're not covered now, we're taking that away from you. And this prevented that from happening. Then there were some long-term reforms that happened, and this happened by the year 2014. The impact on individuals, again, first of all, there were more essential health benefits that were required. Insurance plans were required to cover ambulatory care, emergency care, hospitalizations, maternity, mental health and substance abuse, prescriptions, labs, pediatric, and chronic disease management. Number two, it had another impact on employers from the long term. It guaranteed the availability of coverage. So what it said is payers or insurers cannot deny coverage to certain employers if they operate in that market already. And it also had restrictions on premium rates. So payers could not also increase premiums. The only thing they could base premiums were based on a person's age, their tobacco history, and the number of people that were offered that type of coverage. And the impact on payers was finally that the states were required to open health insurance exchanges. And individuals and small employers, those who had 100 workers or less, could obtain coverage through these state exchanges. There were also a couple other reforms that were large reforms. First of all was the individual mandate. This meant that if a person chose not to purchase healthcare coverage, they are penalized through the IRS at an amount of $695 a year, or up to 22.5% of their household income. This mandate was repealed by Congress in the year 2019. It was politically charged. It was believed to be a tax, actually. And they used the principle of this was taxation without representation. States themselves were encouraged to expand Medicaid coverage to those over the federal poverty limit. And to date, 39 states, including the District of Columbia, have expanded that. And initially, the federal government paid for all expansion, but that is slowly being shifted back to state governments. And again, this is a politically charged thing because all Democratic, those who have more primarily Democratic states have expanded Medicaid, and those who are primarily Republican states have not. And here's my references, a couple from the Kaiser Family Foundation, and then from our text.